My name is Colette Martin. I'm an RN of 17 years, 12 years oncology, and the past 5 years I've been a float resource nurse to all the different floors in the hospital. I'm extremely concerned with the idea of mandating this vaccine for our children. The reactions we're seeing in the hospital with adults are terrifying and they're being ignored. Just some examples of post-vaccine reactions are blood clots, heart attacks, strokes, encephalopathy, heart arrhythmias such as atrial fibrillation. Also in the elderly, we're seeing an increase in falls, syncope, acute onset of confusion with unknown etiology. Also, 2 young and healthy coworkers I know had vision changes, tingling and numbness to lower extremities they're still dealing with. Another coworker developed DVTs. I personally had a patient die 3 months after his vaccines of pericarditis, which we know is a known side effect. Diagnosed 30 days after a shot, no mention to VAERS. Majority of our nurses, nurse managers, and some doctors do not even know what VAERS is. I've spoken to our chief of medicine, managers, other nurses on why we're not reporting to VAERS, and the most common response is, what is VAERS? It's a topic that's very difficult to address in the hospital setting. I bring up my concerns and repeatedly get dismissed. I've been told, I'm sure someone is investigating this. Well, if we aren't, then who is? Especially since Pfizer ended their study just 6 months after the trial started. I also have been told that VAERS isn't the best indication of vaccine side effects. Well, if that's the case, what are we supposed to be looking at? Over 18,000 deaths, 1 million permanently disabled, and the CDC admits only 1 to 10% of reactions are even being reported. And we know that hospitals are not reporting anything. This is not just where I work. I have many nurse friends in other local hospitals in the southeast Louisiana say the same thing. What I also find is highly disturbing is our treatment protocol. I truly believe our protocol is killing our COVID patients. When I ask other nurses their thoughts, they agree. At this point, doctors will admit our main treatment is not working, but it's all we have. We know that's simply not true. It's just what the CDC will allow us to give. Our hands are tied. Back to our children, though. We have chemotherapies that we know have side effects causing blood cancer, such as leukemia, in 10 plus years after giving the drug. We know this because we have real long-term trials on these drugs. We are not just seeing severe acute reactions with this vaccine, but we have zero idea what any long-term reactions are. Cancers, autoimmune, infertility, we just don't know. We are potentially sacrificing our children for fear of maybe dying, getting sick of a virus with a 99% survival rate. Our children are not even at risk for this. As of now, we have more children that's died from the COVID vaccine than of COVID itself. And then the health department to come out and say the new variant has all the side effects of the vaccine reactions we're currently seeing. Now, it's maddening, and I don't understand why more people don't see it, and I think they do, but fear of speaking out and even worse, being fired. This is not something easy for me to come up here and speak about, but I feel a deep conviction about speaking truth and what the nurses are seeing behind those hospital walls. This is not about adults who can choose to research or not. This is about our helpless children, and when I look back on this in 20 to 30 years, I have to know that I did everything I could, and I'm asking you to please ponder this. What side of history will you be on? I have to know this madness has to stop.